Hello and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, a lifestyle and much more. Well, viewers, joint pain can have causes that aren't due to underlying diseases. Examples include overuse, such as heavy physical activity, lack of use, sprains or strains. And so to discuss on this, we have with us today Dr. Santanu Sarma, Senior Consultant Orthopaedics from Health City Hospital. So not to waste any more time, I'll straight away move to Doctor and talk more on the topic which we have taken today. Well, thank you so much, Dr. Santanu, for joining to Good Life, the health show. And the topic which we have taken today is joint pain. And joint pain is nowadays commonly seen in each and everybody. So if we talk about the functions of joint, first of all, so what would be that?
Yeah, thank you, Puja. It's nice to be on this forum, Good Life, for inviting me. It's my pleasure. Yeah, joint pain is a very common problem in these days, very commonly seen amongst all groups of population. Yeah, function of a joint, you can imagine how important it is. It's just allows mobility to whole body. Imagine no joints and a rigid bone with no flexibility will be just comparable to a plank of wood.
Okay.
You cannot move, you can do nothing. So how important joint is for the human body, you can imagine. It brings about mobility to the whole body. And movement is life. Without this, life is just next to still.
Absolutely, absolutely. Movement is life. Actually, now, doctor, if we talk about the factors that cause joint pain, so what would be that?
Yeah, there are many factors which cause joint pain. Age is one of the most important factor.
Okay.
It's more frequently seen amongst the aged group of population. So there may be lots of factors to this. Burning out of the ends of the bones or the joints due to frequent wear and tear along the life may be one of the main reason which causes roughening of the joint surface, causing pain. Then there are many diseases also which affects the joints, maybe due to raised uric acid level, firstly, which we come across a joint condition called gout, which affects mainly the joints. Tremendous amount of pain is seen amongst the patients. Then there are many diseases affecting the joints. We call it rheumatoid arthritis. There are many injuries around the joints, maybe in sportsmen more seen.
All right. All right, doctor, we'll talk more about the factors.
Later period.
Yes, doctor, we'll talk more about the factors that causes a joint pain, but we have a caller at this point in time. Let's take the call and then we'll proceed with the conversation. Hello.
हेलो, गुड आफ्टरनून डॉक्टर. मैं संदीप शर्मा बोल रहा हूँ गुवाहाटी से. हेलो.
जी हम सुन रहे हैं. आप अपना प्रश्न
पूछिए. मेरा जो जॉइंट पेन है, पैर का जो घुटने का जो दर्द है ना, बहुत दिनों से है और अभी बहुत ज़्यादा ही बढ़ गया. खासकर अभी जो ठंड के मौसम में ज़्यादा ही पेन हो रहा है. तो डॉक्टर, इसका कुछ उपाय? ट्रीटमेंट भी मैं करा रहा हूँ लेकिन उसका कुछ असर नहीं हो रहा है.
या मैं जान सकता हूँ आपका उम्र कैसा हो सकता है? आपका
36 डॉक्टर.
36. एनी इंजरी और या तो फिर कहीं खेलकूद में कोई याद आता है, कहीं चोट लगा हुआ ऐसा कुछ है?
हाँ, बैक में है, इंजरी है. बैक में मैं थोड़ा सा ये है, लेकिन मेरा घुटना में बैक का तो पेन रहता ही है, लेकिन ये जॉइंट जो घुटना का पेन है वो बहुत ज्यादा है डॉक्टर. है उसमें कोई इंजरी नहीं है ऐसा कुछ?
एनी स्वेलिंग?
नो डॉक्टर.
ओके. 36 years of age में without any injury and no swelling, थोड़ा सा तो देखना पड़ेगा, ऐसे बोलना तो मुश्किल है. Have you gone for exercises and physiotherapies?
नहीं डॉक्टर, फिजियोथेरेपिस्ट को मैंने ये नहीं कंसल्ट नहीं किया अभी तक. सिर्फ एक बार डॉक्टर को दिखाया था तो वो उन्होंने एक्सरसाइज एक बार बताया, लेकिन ठीक से वो काम नहीं कर रहा है. मैं और दवाई मेडिसिन दी है, मेडिसिन को मैं ये लेता हूँ. जब भी पेन होता है तो मैं पेन किलर ही है उसमें लेता हूँ, तो उसका असर थोड़ा देर के लिए रहता है, उसके बाद तो फिर वैसा ही रहता है, पेन रहता ही है डॉक्टर.
नहीं, वो तो पेन किलर इज़ नॉट ए सोल्यूशन, पेन किलर सोल्यूशन नहीं है. तो मेरे ख्याल से आपको हम कोई ऑर्थोपेडिक डॉक्टर को तो दिखाना है. इनके एक एक्सरे ज़रूरी है, कराना है. उससे ज़्यादा इन्वेस्टिगेशन MRI ज़रूरी है तो कराना है. उसका बाद थोड़ा सा इवाल्यूएशन ज़रूरी है किस लिए पेन हो रहा है. और मेरे ख्याल से आपको थोड़ा सा फिजियोथेरापी या तो फिर मसल बिल्डिंग एक्सरसाइजेज जो नी को सपोर्ट देंगे वो करने से आपको थोड़ा सा इम्प्रूवमेंट होना चाहिए. यू शुड बी सीरियस विथ योर problem, otherwise it's going to become a chronic problem for you.
Absolutely, absolutely. Thank you so much for calling at this point in time. I'm sure the answers which you just got it from doctor must be benefited for you. Well, doctor, indeed you have clearly mentioned that painkillers are not at all a solution and one should not stretch their problems for long. So they should immediately go and see an orthopedics if they find any kind of problem, isn't it?
Yeah. No, the painkiller is at all not solution for this type of problem.
Okay.
So over the counter, there is misuse of painkillers. So and the disease prolongs. It goes from early stage to late stage, and it miss the actually time valuable time is lost.
Okay.
And then there are also side effects of these painkillers, which are more or less known to all in nowadays.
All right, all right. Our numbers are flashed on your television screens, viewers. So if you have any queries regarding the joint pain, so you can call up and ask your question to Dr. Santanu here, who is right now with us at Good Life, the health show. All right, doctor, now coming back to the question, we were talking about the factors that causes joint pain. So there is also one more important question that surfaces in everybody's mind is like, what is osteoarthritis? Now, what is that?
Sorry, I couldn't get your point. What is?
My question to you was, yeah, osteoarthritis, yes.
Okay. It's an inflammation of the joint, to be spoken in simple language. There may be many reasons to it, primary and secondary. Primarily, there is no known factors, only due to age, the joints wear and tear, and it causes pain due to roughening of surfaces, decrease of joint fluid inside the joints. Gradually the geometry of the joints change, your inclination, alignment, everything changes, and this causes, you have seen some knees with bend, no? So that they feel very difficulty in walking. This is called osteoarthritis. There may be other causes which we call as secondary osteoarthritis due to other causes, maybe injury, maybe some operation earlier, maybe some disease inside the joints which causes osteoarthritis. So it's basically an inflammation of the joints.
Okay. All right, doctor, is there anything to do with the weight of a person? One has to control the weight for this?
Yeah, absolutely. Obesity is one of the main reasons for this joint overload. This causes more increase in wear and tear of the joints. So lifestyle, diet, physical activity, obesity, these are all interrelated for the, means what you call this aging of the joints.
All right, now what are the joints that are involved in osteoarthritis? What would be that, doctor?
Yeah, means mainly this weight-bearing joints are
Okay.
involved in osteoarthritis. It's very rare to see the joints of upper limb. You know, hands of the joints are very rarely seen osteoarthritic changes. The joints where we stand or where we walk, upon which the joints bear the weight of the body, those are the joints which are mainly those joints go for mainly osteoarthritic changes. So the knees are the one joint which very frequently seen in osteoarthritis, and hips also bear body weight, but hips are a ball and socket joint. There are many types of joints in the body. So hips are ball and socket joints. So the joints are the weight is distributed among many point of contact in the hip joint. So the wear and tear in the hip is very rare or few in comparison to knee. Knee is a constrained joint.
Okay.
There is movement in only one plane, means it's sort of a hinge joint. You have seen that door hinge, no? That knee only moves in one plane.
Okay.
It's a hinge joint. So any rotational forces or any impact is borne by the knee very badly. So knee goes for early osteoarthritis more quickly than the hips. Then again the knee is more. Then spine, there are many small joints in the spine. So backbone is not rigid. Backbone has movement.
Okay.
You can bend forward, you can straighten up, you can bend backwards. There are multiple small joints in the back. So this also goes for osteoarthritic changes. So that is why there are many people complaining of backache, neck pain.
So these are some of the factors which
there
is
may
also
be many
related.
reasons,
Absolutely. These are the factors and these are the joint frequently, what are the joints frequently involved in osteoarthritis? Doctor, we'll talk more on the discussions and we'll proceed with the conversation, but after this short break. Well, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Puja, and we are having a fruitful discussion on joint pain, which is actually frequently seen these days in each and every person. All right, our phone lines are also open and the numbers are flashed on your television screen. So if you have any queries regarding joint pain, so Dr. Santanu is with us at this point in time with Good Life, the health show, and hopefully he will be giving you all the answer. All right, Doctor, we have a caller at this point in time. Let's take the call. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় হয় মোৰ মানে হাতৰ এই পতাখনৰ তলত যেটো গাঠি আছে খাৰু যে পিন্ধু হিখিনি জায়গা মানে গাঠিটো ইমান বিখায় মই মানে নাৰ্ভৰ ঔষধ বুলি টেবলেট খাই আছো কিন্তু ভাল পোৱা নাই আকৌ একো কাম কৰিব নোৱাৰো তাৰ মানে হাতখনৰে খুব বিখায় গাঠিটো হেল্ল'
আপনার এটু সৰু মানে ৰিষ্টৰ যেটো খাৰু এটু ৰিষ্টৰ এই গাঠিটোৰ বিষ বুলি কৈছে নহয়
হয় হয় মানে কাম কৰিব নোৱাৰো হাতখন ঘুৰাব নোৱাৰো এনেকুৱা বিখায় হাতখন ঘুৰাব নোৱাৰো মানে হাতৰ
ফুলে নেকি গাঠিটো ফুলে
অকমান অলপ ফুলা যেন লাগিছে অলপ ফুলিছে
অকল এটা জায়গাতে বিখায় নে গোটেই গাঠিটোতে বিখায়
আঙুলি মানে গাঠিটোৰ পৰা আঙুলিলৈ বিখায় তাৰ মানে একদম যে গধুৰ হৈ থাকে হাতখন তেনেকুৱা লাগে আৰু আঙুলি কেটা কিবা টানি টানি ধৰে মানে কিবা এটা যেন গধুৰ বস্তু হে লগাই থৈছে তেনেকুৱা লাগে
কিবা পৰিছিলে নেকি কেতিয়াবা দুপসুপ পোৱা মনত পৰে নেকি
নাই নাই এটো হঠাতে হোৱা যেন লাগিছে আৰু কেতিয়াবা আপোনাৰ সেই ডিঙিটোৰ পৰা গোটেই হাতখন মানে টানি থাকে তেনেকৈ আৰু নাৰ্ভৰ ঔষধ খালো মই ভাল পোৱা নাই
বুজিছো তে হয় এটো আসলতে আপোনাৰ এই স্পন্ডিলাইটিছৰ নিচিনাই হৈছে বস্তুটো এক নম্বৰতে দুই নম্বৰতে ডিঙিত বিখায় না নিবিখায়
ডিঙিটো নিবিখায়
নাৰ্ভ
ডিঙিৰ মানে
ডেফিনেটলি
এটা
আপোনাৰ
চাইডৰ
ইনভলভ
কথা
হৈছে
কৈছে
এইটো
আপুনি,
বিষয়ত
যিখন মানে হাতৰ ওপৰৰ ডিঙিখিনি চাইডৰ।
হয় 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 হয়
কেতিয়াবাহে টানে সেইটো, কেতিয়াবা মানে সদায় নহয় আৰু। ধৰক হাতখন বহুত বিষাইছে, তেতিয়া সেই ডিঙিটোৰ পৰা অকণমান বিষায় আৰু।
আপুনি তেতিয়া ধৰে আহে যেন লাগে আৰু আপোনাৰ গধুৰ বস্তু উঠোৱাটো একেবাৰে বন্ধ কৰি দিব লাগে। আপোনাৰ বয়সটো জানিব পাৰিম নেকি?
52।
আপুনি অলপ কেলচিয়াম ছাপ্লিমেণ্টেশ্যন ল'ব লাগে, খাইছে বোধহয়। আৰু
কেলচিয়াম টেবলেট
যদি
খাই আছো মই।
কেলচিয়ামটো ৰেগুলাৰলি খায় আৰু ছেকেণ্ডলি ডিঙিৰ এক্সাৰচাইজ কেইটামান আৰম্ভ কৰিব লাগে ৰেগুলাৰলি। আৰু এনেকুৱা
ডিঙিটো
নহয়
ঘূৰাই
যে
থাকিলে
ফিজিঅ'থেৰাপি
হ'বনে?
দেখালে কেইদিনমান কৰিলোঁ তাৰপিছত পাহৰি গ'লোঁ বা থাকি গ'ল, তেনেকৈ নহয়। আপুনি কণ্টিনিউৱাছলি কৰিব, ক্ৰমান্বয়ে বঢ়াই যাব লাগে, কমকৈ আৰম্ভ কৰি। আৰু নাৰ্ভৰ ঔষধ কেইটামান লাগে, সেইকেইটাও খাব লাগিব।
নাৰ্ভৰ
মই
খাই আছো
এতিয়া
মই।
আপোনাৰ কথা শুনি পেলাই সেইখিনিয়ে ক'ব পাৰিম, তাতকৈ চাব লাগিব যদি আৰু বিশেষ কিবা
Okay.
কৰিব লগা থাকে।
All right, thank you so much for calling at this point in time. And doctor, there must be a lot of treatments, many more options for the treatment procedure, but one has to know the treatment procedure of a joint pain. So could you please tell us about the treatment procedure? How can one diagnose a joint pain? And is there a treatment procedure depends on the cause of pain? What do you have to say?
Yeah, treatment always has to be done according to the cause. You have to find out what's the cause of the pain, what's the cause of inability,
Okay.
and only then a correct treatment can be formulated. Otherwise, patient will not be benefited if you do not diagnose what's the cause of joint pain. Joint pain can be diagnosed, first of all, clinically. We have to see how is the joint. Then there may be some redness, there may be some swelling, there may be some fluid in the joint, there may be some blood in the joint. You have to clinically examine firstly, then secondly we may require some investigation, blood test.
Okay.
There may be uric acid level may be raised, maybe there are some infections in the joint which may cause some blood markers, raised level of blood markers which comes out in blood investigation. Uncontrolled diabetes may have joint infection.
Okay.
There may be lots of diagnoses why joint. There may be some immunological disease, there may be some connective tissue disorder. There are many joint disease which can be diagnosed by doing blood investigation. Then we have to take help of radiological investigation like X-ray, which gives us nice clue about how the bones are, whether bones are weak, whether there are any foreign objects inside the joints. Then MRI is more or less a routine investigation to see how the tissues inside the joints are. We need to do an MRI if we have not been able to diagnose with the earlier modalities like blood and X-ray.
Okay.
So
Okay.
these are some of the investigations we need to do to diagnose the cause of joint pain.
All right.
Then
Now,
we
doctor,
have to
these are these are
formulate
these are
after
some of
coming.
the factors to know, like if someone is suffering from joint pain or not. Now, if we talk about the age group, which age group are we talking about for joint pain? And if we talk about, is it mostly seen in males or females? What do you have to say on this?
Yeah, age group is definitely, I have spoken about. Elderly age group is more frequently complaining of joint pain.
Okay.
And there are some joint disease which you call juvenile rheumatoid arthritis or in any infection also, which we see in the early age group where there is joint pain and swelling. So we need to see and diagnose properly if we see joint pain amongst different groups of people.
All right.
And then
All right. There must be also
what was your
taking
second
care.
question?
Yes. All right, doctor, now we have to take care after joint replacement as well. Many of them has gone for joint replacement, which is also part of the treatment. Now, if we talk about the care taken for the ones who have gone for the joint replacement, what would be that?
Joint replacement surgery is itself a different chapter. So it's not everything over whenever when you take for operation.
Okay.
After operation, care is equally important as the during operation care. So physiotherapy is an integral part of the post-operative regime after any joint replacement surgery. It has to be done gradually under a physiotherapist monitoring, and once patient is able to do themselves, then she can or he can gradually take over, but he has to continuously improve upon the physiotherapy or do more and more exercises gradually. Then there might be some lifestyle modifications. So if he previously used that Indian type of toilets, then he may have to shift over to English, which we call a commode type of use, and then frequently these high impact sports has to be avoided. Initially,
right, doctor,
gradually maybe due to
yes, you were talking about the lifestyle, that one should have a proper lifestyle, and lifestyle should be changed accordingly to your health reasons. Now, if we talk about the wearable things, like we should also see that which shoes are proper for them to wear, because it also can lead to joint pain. Something is related to that. What do you have to say?
Yeah, of course, these are very important points you have brought about. We usually advocate platform type of soles.
Okay.
And then it's not necessarily, it should not be that it should be flat. It can be raised, but it should be platform, means uniformly heel to forefoot. There should be a slope, but that pencil heel type of shoe should be avoided, because it puts about tremendous amount of burden on the knees and spine. So there comes the factor of muscle fatigue, and also these causes various type of pain around the joints.
All right. Now, doctor, whichever field we are talking about, there are some of the fields, like which field I am, we sometimes have to do some kind of shows. So for that, we have to wear the shoes which are not at all comfortable for us, but literally we have to wear it. So what would be the after effects of that, and how can we take care of our heels? What do you have to say?
Yeah, after effects, maybe I have spoken about, there is muscle fatigue around the joints due to excessive eccentric pressure or force due to this misalignment of the foot to the upper joints. So this muscle fatigue causes pain. And then rest is the main advice from my side after such type of footwear, and maybe frequently ice pack may have to be applied, and some medications temporarily to get relief from immediately.
All right. Thank you so much for those advice, and I'm sure the viewers who have watched our show must be benefited with the answers the doctor gave. And well, viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.